would like to introduce our next speaker, Evelina Mincheva. Sorry if I mispronounce your last name. She's a social worker with extensive experience in the field of addictions and the founder of Nezavisiма Foundation, whose mission is to support women affected by addiction through a comprehensive program of treatment, rehabilitation, and social inclusion. The floor is yours.
Hello, everyone. Thank you for inviting me, Dianova. My name is Evelina, and I'm a social worker specializing in addiction. Alongside my practice, I'm training in psychodrama and the therapeutic spiral model, which woke up my interest in trauma and especially trauma related to addictions. Today, I will talk about trauma and recovery among women in Bulgaria. Sorry, it doesn't let me. Okay, fine. This is topic very interesting, a topic at the intersection of social vulnerability, mental health, and gender inequality. I will focus now on how factors like poverty, violence, and stigma shape women's access to care and influence recovery services. I have to say Bulgaria is a country in Eastern Europe, and it's about 6 million people, so we're a very small country. And many women in our communities grow up with multiple traumas. They experience domestic violence, sexual exploitation, childhood trauma, and very often live in poverty. These overlapping challenges require careful and gender-sensitive support, which is unavailable at the moment in our country. Women with substance use issues often face a double burden: gender-based violence from one side and both institutional and social stigma. I would say medical stigma as well, especially in pregnant women with addictions. In Bulgaria, most recovery services are designed for men, and gender-sensitive care is very limited. Trauma-informed approaches are largely absent from addiction treatment. I will show you the latest data. You can see the data, and it's very worrying. This is the Q2, April to June, the registered cases of acute intoxication related to psychoactive substance use. And this is our national source of data. So you can see the girls under 15. So once they're high number, and this is very disturbing, and this early substance use among girls reflects the trauma they face. And it's crazy because we recently did a local, in our municipality, we did a research among the students 14 to 19 years old, and the number of the girls is huge. It's like double the boys. So we got 150 girls tried for first time alcohol at 12 years old, and we got 80 boys tried at the same age. So it's very disturbing. These numbers reveal risks our system is not addressing, and the real figures are likely higher, not likely, they are higher. These are only recorded cases. Right. In Bulgaria, free recovery opportunities are extremely limited. We got only one psychiatric hospital that offers few places for people to recover, and there is no specialized women ward with bed, especially for women. We have no programs that allow women to enter treatment with their children. Therapy is mainly behavior focused and aiming to reduce substance use, but often misses underlying causes, including trauma and social disadvantages. Trauma-informed care is still in early stages. I was ashamed to say it's not existing. So that's why I said it's in early stages. So treatment teams need more training and more support. Women with children or complex trauma often lack support, showing gaps in services and the need for integrated trauma-informed and family-focused programs. In Bulgaria, we have no programs for pregnant women. Specialized support for their medical, psychological, and social needs is non-existent. Many mothers face stigma, fear of losing custody, or lack access to care, which prevents early intervention and affects both their health and their children's well-being. In this slide, I would like to share with you 2 cases from my practice that illustrates these gaps. I worked as a social worker in one of the therapeutic communities, a private led by NGO. So these are only 2 of the many cases I want to point to make clear. So PP, 36, grew up in a family affected by substance use and discovered her mother's body after she died by suicide. As a young adult, she was in an abusive relationship and became a victim of sexual exploitation, forced to have 2 abortions. Even after several treatment attempts, her trauma and experiences of violence were never addressed. Care focused only on her addiction and to maintain her drug-free. NN, 26, she experienced physical violence. She was sexually abused as a child and began drinking at 14. Later, she started experiencing any drugs. She started trying any drugs that she can afford. She was in a relationship with a much older partner. The male was on substitution treatment and she became a mother at 24. So during her treatment, she saw her boy only 3 times. Once for 2 hours after the first 3 months, one for 12 hours on her 6 months, and one for 24 hours when she finished her 9 months in the recovery. And it was insane. So she left.
Sorry, 1 minute left.
Yeah, okay. I'm almost finished. And these are the facts that led to think what we can do, what can be done to improve this situation. In February, we established the Foundation Independent to focus on woman-centered, trauma-informed recovery. Since then, we have taken steps to raise awareness, build capacity, and advocate for gender-sensitive programs in Bulgaria. Thanks to a space provided free by our municipality of Gabrovo, where I live, we opened the advisory center. This is one of a kind in Bulgaria, the first one, to offer woman-centered services. The center also addresses intersectional needs and provides safe, supportive environment for women. We have built strong connection with local institutions, medical specialists, NGOs, and community partners, creating a stronger support network for women in recovery. We really want to our goals are to integrate trauma-informed care and gender equality principles into addiction treatment in Bulgaria, to develop programs specifically for women, including pregnant women and mothers, to provide treatment options that allow mothers to stay with their children during recovery, to promote right-based, inclusive care that responds to diverse needs. In conclusion, women's trauma histories combined with systemic and social barriers demand tailored gender-sensitive responses. By integrating trauma-informed care, creating women-focused programs, and allowing mothers to recover without separation from their children, we can build a system that truly responds to women's lived experience, and this is very important. And the work is starting now. Thank you very much for the opportunity to share our situation in Bulgaria here with you. And thank you to Dianova for the opportunity to share with you. Thank you.
Thank you. Thank you, Evelina. Your organization, Nezavisiма, Independent, is pioneer in this conversation in Bulgaria, which is very brave. You're doing a tremendous amount of work, so congratulations. You're putting trauma and gender perspective at the forefront of addiction recovery at a national level. So we wish you a very fruitful journey ahead in this mission. Thank you very much again for joining us today and share all this.